I'm Michelle Johnson. I'm a physician at Women First. Many patients wonder exactly what is a hysterectomy, and there is sometimes some misconceptions as to what that procedure is. A hysterectomy refers to removal of the uterus and cervix. You can also perform a hysterectomy where the cervix is retained, and that's called a supracervical hysterectomy. A patient might need or knows she needs to have a hysterectomy when she has uterine fibroids, which are benign muscle growths within the uterus that can cause the uterus to enlarge. They often result in heavy bleeding or pelvic pain. Any menstrual problem that is unable to be controlled with more conservative treatment, such as oral contraceptive pills, IUDs, or endometrial ablations. A woman who has pain that cannot be controlled as well. What to expect when you're having a hysterectomy. We perform hysterectomies in a minimally invasive fashion, which is laparoscopic. So women will come into the hospital, day of surgery, they'll go to the operating room where they'll be placed under general anesthesia. Typically, they will have 4 small incisions made. Surgical time, depending on the indication, is roughly usually somewhere from 1 hour to 2 hours. So having a hysterectomy generally does not leave any side effects because we really only need our uterus for childbearing. Because of our minimally invasive approach, many of our patients go home same day. We find that they require very little heavy pain medicine, such as narcotics, and they're able to get moving in the house very quickly. They do have some restrictions on their activity level, but within a couple weeks, if your job does not involve heavy lifting or straining, you could actually return to work and you will be doing many normal things in your house prior to that time. A patient would have to wait for resumption of sexual activity for 4 to 6 weeks if they've had a hysterectomy where their cervix was removed. If they had a hysterectomy where they retain their cervix, then they could become sexually active within 2 weeks. One of the misconceptions that women have when we start talking about hysterectomy is they become fearful that it involves removal of their ovaries. But removal of the ovaries is a separate procedure, and hysterectomy is only focused on the uterus and cervix. Another misconception that patients have about having a hysterectomy is that it might cause them to go into menopause. Again, that is only if we remove the ovaries, which we avoid unless there's some type of pathology involving the ovaries. So having a hysterectomy generally does not leave any side effects because we really only need our uterus for childbearing. Another misconception about hysterectomy is patients worry that they're going to then develop prolapse. Prolapse is when our bowels or bladder or the top of the vagina starts to fall. And because of the way we perform our hysterectomies now in a more minimally invasive way, that is much less of a problem than in the past. The majority of our hysterectomies that we perform at Women First are all done by a minimally invasive approach, which means primarily some form of laparoscopic surgery. A few surgeries will need to be done in an open manner, which is then considered no longer minimally invasive. Sometimes it seems that the media makes patients think hysterectomy is a bad word, but having that procedure done, many women need it to improve their quality of life. And really, the uterus serves no function for us after we're done having children. So the only reason to technically retain your uterus is if you're going to want to become pregnant. So we hope that we can talk through that process with patients and make them understand that for some people, that's their only option based on the problem that they have. And in my clinical experience, I'd say 99.9% of my patients later tell me, this was the best thing I ever did. I'm so glad I did this. I wish I had done it sooner.